When we're considering a prostate procedure or a surgery for the prostate, the very first thing you have to ask a patient is his interest in ejaculating. What does that mean? That means that a lot of the surgeries procedures will cause what's called retrograde ejaculation, that when you orgasm is the feeling, the fluid, instead of coming outwards, will go back inside. What does that mean? So as far as anatomy, we have the urinary channel and we have the ejaculatory channel. It's like a freeway. Here in California, Los Angeles, it's like the 405 and the 101. And so when men orgasm, the fluid shoots outwards and uses the same channel. When you damage this valve, the fluid, instead of going outwards, goes back inside. We call it retrograde ejaculation or dry ejaculation. Now, the TURP, the green light laser, to a lesser extent the aquablation, and some of these procedures resume as well, have a risk of retrograde ejaculation, which is permanent. So you have that procedure, you get a dry ejaculate. Now, some men are not bothered by it and some men don't like it. And you can't assume until you ask somebody. So when I started in practice, I saw a patient who was 75 years old. I just assumed it didn't matter to him. But I did ask him, and it did matter to him. He said, hell no, I'm not getting a TURP because I like ejaculating. The only real treatment is the urolift that doesn't impact it. But certainly if you have somebody who doesn't really care about ejaculating and doesn't care that no fluid comes out, the TURP, the green light laser, to a lesser extent the aquablation or the resume or fine treatments. If it bothers you and you don't like it, you consider the urolift and probably the PAE, the embolization.